So, hello everyone, and welcome back to the MK Community Foundation podcast. We're joined by amazing guests today. It's a pleasure to introduce Sue Burke, CEO of MK Acts. Hello, Sue, you okay?
Hi, Daniel. Nice to see you.
Nice to see you. How are things?
Yeah, really good. Thank you.
So, thanks for joining us today. The aim of this is just to get to know local organisations and local charities and to showcase what they do. So, I thought it'd just be nice to just sit down with you and have a conversation.
Brilliant.
So would you mind telling us a bit about yourself and the work that you do at MK Acts?
Yeah, so MK Act has been serving the community of Milton Keynes for the last 45 years and domestic abuse services within the borough of Milton Keynes. So we've got a range of services. So we run the Refuge, which has got 28 flats for families, and that's across 2 different sites. We have our crisis service that people can phone into. So that's got a victims helpline and a professionals helpline. And that's where we help people and, help them move forward and make decisions. We've got our outreach service and our perpetrator programme, which is for those that use violence within their relationships. So we run groups and we also support the partners and family members of those that are attending the group. We've got a counselling service. We provide training to professionals and other agencies. And we've got a wonderful group of volunteers as well that do lots of things within MK Act. And we do work with children and young people, particularly within the Refuge.
Amazing. Oh, it sounds like you're very busy.
Yes, it's quite busy. We have about 2,000 people come through our services each year.
Oh, wow. We're aware, like you said, that you've been providing safe emergency accommodation for over 45 years. How did MK come to fruition?
So there was a lady called Carol and a man called Terry. They used to be welcomers when Milton Keynes was being built, and they welcomed people to Milton Keynes when they moved onto the new estates. And what they were soon discovering was that there was a need for refuge accommodation and domestic abuse support, because they were seeing quite a bit of it for people that were moving into the city. And so they worked with Milton Keynes Council at the time to try and identify a building. And while they were waiting for that building, Carol took our first family into her own home. So I think she had about 3 children and a dog.
Oh, wow.
And they lived with her and her husband for a couple of months. And then once the new refuge opened, they moved into there. And then it's sort of grown and grown from there. And actually our first resident was our first member of staff. It's grown and grown. And we've been really amazingly supported by the council and by the Community Foundation and generally the whole community of Milton Keynes. They've always supported us.
Oh, that's great.
So yeah, we've started with 1 member of staff, and now we've got around 30 to 35 members of staff, 20 volunteers.
It's fantastic the way that something can grow just so quickly because of obviously the need that it's providing. Just you said about how the foundation has supported MK Act, and so I wondered if you could talk a bit about the emergency grant MK Act were awarded during the lockdown and how it helped support your work.
Yeah, so it was really helpful because actually what we saw was we were having to support our clients much more around their basic needs, because often they were leaving when they were able to, and often just with what they were standing up in. So we were having to give people a lot more support around that. And obviously our costs increased significantly during COVID just because of all the extra things that we needed to pay for example, people being able to work from home, so all the equipment, PPE. Who knew PPE was so expensive? And so it's all stuff like that, so it increased our costs. So the sorts of things it paid for, we had one of our clients was a nurse and she had to leave. She left with nothing, but obviously she needed a washing machine to wash her uniforms because she was going into the hospital, so that we were able to buy her a washing machine with the money. The women in our refuge were very isolated, so for them it felt like a double lockdown, because obviously the refuge has to be very confidential, even though it's quite a fun place to be most of the time, and then there was the lockdown because of COVID. So we wanted to ensure that their well-being was kept at the forefront. So we were able to buy things like exercise mats because we had yoga, they could do it in their flats, and we had lady who does kickboxing with the women, so they were still able to do activities in their flat. And also it paid for things like Zoom and data so that they could access the support, and it helped our Wi-Fi as well, our Wi-Fi infrastructure, so that we were able to support them as much as possible. And actually one of the things here is sewing needles, so we were donated some sewing machines, and we were able to buy some equipment so that some of the women could do that to keep them occupied. So yeah, it was used for a whole numerous things, but it's about people's basic needs and, you know, keeping their well-being and everything else in a good place.
That's so good. Well, we're really happy that the money was able to support, you know, a majority of people. So we're aware as well that you delivered a domestic abuse awareness in the workplace workshop. Would you mind talking about the importance of awareness around domestic abuse and how important it is in the workplace as well as at home or in the general public?
Yeah, so we know that 1 in 4 women and 1 in 6 men will experience domestic abuse in their lifetimes. If you think of your workplace, there's going to be people that are working with you that are experiencing domestic abuse, and people spend a lot of time at work. And I suppose it's a good place for people to access support if they need to, but also for their employer to do things that maybe help them to leave or just to make their situation a lot easier. And also employers have a responsibility around their employees' health and safety. So, I mean, if you're thinking it from a cynical basis, it has an impact maybe on your productivity, your sickness rates, the cost of your work on your workplace around domestic abuse, but also there's the human element as well. So employers can put in place things like changing shift patterns, letting them access services during work time so they can sort stuff out. So we've had clients who their place of work has allowed them to come out for an hour or two to get the support that they need, which is brilliant. Maybe advance their salary if they need to put a deposit on a rental property, and time off. So somewhere like Milton Keynes Hospital give their staff 6 weeks paid leave if they're living in a domestic abuse situation. So that's really positive to do. Yeah.
Amazing. Yeah. So I suppose that awareness then kind of gets translated into actual things that can support people. So, you know, whether you said, like you said, whether it's an extension in pay or something like that. So the awareness kind of brings that from that. And that's really good. Yeah. And just in terms of the workshop, is that something that you plan on running again or in the future or
Yeah, so we've been commissioned by Public Health to run it another 4 this year. So anyone can book on them for the next year, and it's on our website. We're also happy to come into places of work and do the training in places of work. And we're also happy to support companies and organisations around their domestic abuse policy and advise them. And we do have a pro forma that we can support people with and make it relevant. We've also got 2 webinars on our website. So that's www.mk-act.org. But if you Google domestic abuse Milton Keynes, it comes up. And we've got 2 webinars on there, one for employers about what you can do. They're just about 10-15 minutes. So one for employers to say, this is what you can do. And then on the other one, it's for employees. So if you've got a colleague, somebody that sits next to you, maybe the things that you can look out for and maybe the things that you can do to help that person.
Oh, that's fantastic. Great to hear that you're going to be running it again, because it's just so important, isn't it? You know, for it to actually be in the workplace and for people to be aware of it. But it's just fantastic. So as you may know, Milton Keynes recently put in another bid to become a city. So from MKACT's perspective, or from your perspective, what does the future of Milton Keynes look like or feel like?
I already call it a city. It's a bit naughty. So, I mean, I live in Milton Keynes. I love living in Milton Keynes. I love working in Milton Keynes. And I love having my family in Milton Keynes because there's just so much to do and opportunities. I think from MKACT's perspective, you know, obviously Milton Keynes is getting bigger, which will mean more demand on our service. And we're seeing that already, you know, that the figures are creeping up. And so for us, it's for us to respond and to make sure that we're providing enough service for people that need it, you know, providing the service that we currently provide and being able to do that going forward. And that's working with the community of Milton Keynes. They've always been really supportive, and the organisation. So I think it's all working together. And I think it's also an opportunity when new people are moving to Milton Keynes and getting to know Milton Keynes, that actually you do have a domestic abuse service that provides, you know, high quality to its clients, but also around zero tolerance around domestic abuse and having that message. And, you know, Milton Keynes Council have made a stand around White Ribbon Day, and I think looking to become a white ribbon city. So I think it's, you know, making that stand as a city about, you know, zero tolerance around domestic abuse.
We celebrated International Women's Day. Did you or do you have an inspirational woman that you look up to?
Yeah, so I was thinking about this actually, and there's obviously the usual famous ones that you aspire to, but actually inspirational women every day. So I've got my trustees, my staff, my volunteers all work really hard, do their best for our clients, go above and beyond, and they're really inspirational. And I just look at what they do every day and think, oh my goodness, how do you do it? And then also our clients, because they're pretty inspirational, I think. You know, if you think about being in the worst time of your life and making massive decisions, and you're fearful for your life and for your safety, and then you break free from that, or you live with that. Actually, you know, some people, you know, stay in situations because they need to. And so I think our clients definitely are a real inspiration, and it's really lovely to see them come into, you know, we've got a new woman moving in today into the refuge, and it's really lovely to see her, you know, take a sigh and think, oh, you know, I'm safe. And then we see ones that are moving on to their own house and, you know, have done really well. So yeah, I think my inspiration is the people that I work with and the clients that we work with.
Yeah, I'd have to say it's the same with this organisation as well. There's so many women here that I look up to as well. And it's just, again, like you said, how do you do it? You know, people just are able to just continue with something, and whether that's, you know, not something that they don't want to experience. Sometimes they're able to just kind of push through. But again, it's about that awareness of that you don't need to kind of push through all the time, and that there are services like MK Act that will support you, and, you know, in a variety of ways, whatever stage that you're at.
Definitely.
Yeah.
And we don't judge that. It's wherever people are, and it's whatever, it's a bit of a cheesy word, the journey that they're on, but we, you know, we'll help them, and it's whenever they're ready, and they're experts in their situation. They know when they're ready, you know, to move on and to make those decisions that they want to make.
Amazing. Well, thank you for joining us today, Sue.
Thanks for having me.
Yeah, thank you so much for joining. It's been really good to hear about the work that MK Act do. We'll speak to you soon and hopefully work together soon in the future.
Great. Thank you so much.